lesson on psoriasis. By the end of this video, I want you to understand what psoriasis is and how it's treated. Psoriasis is a pretty common skin condition that results in those scaly patches on the skin, such as in this picture here. And it's actually an autoimmune disease. So let's explore what that means. So what happens is a stressor such as psychological stress, smoking, alcohol, infections, cold, dry air, just obesity in general. It causes the body to react inappropriately in an autoimmune response. So the body's going to have an inflammatory response that's not normal, and it's going to result in the T cells attacking the healthy cells. So those healthy cells are going to be attacked, and then it's going to cause the buildup and overproduction of skin. So we're going to have skin cells that are going to start to build up on top that shouldn't be there. And this is going to be hard for the blood supply to supply those cells. So then they're not going to get enough oxygen, they're not going to get enough nutrients, and they're going to start to die off. And that's going to leave you with those itchy, white, flaky patches on the skin. So psoriasis is a genetic disorder, so it's a lot likely to be passed on through generations. So if you have family members that have it, you have a chance to get it as well. So living with psoriasis can be pretty stressful. If a patient can manage their stress and try to take care of their skin lesions as well as possible, the psoriasis could go into remission. Unfortunately, it very easily flares back up with any of those stressors that we talked about. Now let's talk about the different types of psoriasis that there are. So plaque psoriasis is the most common kind, and it's probably the type that you think about when you think of psoriasis. So it results in those thick patches of red skin with the white scales on top. So inverse psoriasis is located in areas like the armpits, the groin area, under skin folds. So this type of psoriasis gets worse with friction, which is really hard to avoid in those areas, so it's very difficult to treat. Goutot psoriasis looks more like pink reddish spots. This type usually comes about after like an upper respiratory infection. As you can see, it's just like these little red spots. It looks a little different than the other psoriasis. And this person also has a plaque psoriasis right here. Pustular psoriasis shows as pus-filled blisters, as you can see in this picture. Chemicals such as like medications, and like different infections, those can cause this type of psoriasis to come about. For example, it's been found that chemicals in cigarettes can actually trigger pustular psoriasis in people. Erythrodermic psoriasis is the most rare and the most dangerous form of the disease. So it appears like a very red rash that's going to cover large areas of the body instead of just the patches that usually occur with psoriasis. So, and the lesions aren't defined. Notice how it's covering all of the skin on this foot here instead of just like a patch. So these patients, they might have variations in their temperature, and dysregulation of the skin will cause fluid and protein deficits in this patient. So this type can occur in patients that suddenly just stop treating the disease, and then it kind of like backfires and this will happen. So whenever you have a new patient, you should always assess all of the skin on their entire body, including like their scalp. So remember that psoriasis usually shows up as red patches with dry skin or cracked, itchy skin. The patient that has psoriasis could also complain of painful joints, which could result in something called psoriatic arthritis. This is rare, but it does happen. And it requires a rheumatologist to be on board to help with the care of this patient. This is just showing a picture of psoriasis actually occurring on the nail. So whenever you have a patient with psoriasis, it's really important to check out the skin lesions and just make sure that they're not infected. Secondary infections can occur because the patients might be scratching at those lesions, breaking them open, and allowing bacteria in, which could possibly result in cellulitis. Those patients that have that inverse psoriasis, you know, the psoriasis is in really moist areas of the body, so it could start to grow some fungal infections in there. Okay, so next let's talk about treatment. So psoriasis results in dry, crusty skin, so it's super important to keep it moist. Emollients are really good to help with that. You may also use salicylic acid or corticosteroids to help heal those patches by tackling the inflammation that occurs. Antifungals might be needed in those patients that have that inverse psoriasis where it starts to grow that yeast. Sometimes skin topicals just aren't enough to keep the psoriasis under control. So severe cases might call for something called methotrexate or even biologic therapy. Biologic therapy is typically the last option due to the expense and the side effects. So what you need to know about these is they do suppress the immune system, which is good for treating the psoriasis, but also dangerous for the patient because they're more likely to be susceptible for other diseases. Interestingly enough, UV phototherapy is used to help control the psoriasis in some patients. So it's just really important to stress the importance of avoiding sunburn because that will worsen the lesions. All right, so with patients that are trying to manage their psoriasis, you need to remind them to try to manage the stress of their life. I know this is hard, but it's really important. They're going to need to continue to moisturize their skin. They need to stop drinking and stop smoking, and they need to get some sun, but avoid sunburn. So our priority nursing concepts for the patient with psoriasis include immunity, tissue skin integrity, and infection control. Okay, now let's review the key points. So psoriasis is an autoimmune disease that results in the T cells attacking healthy cells, and the skin cells then multiply too fast, and the cells build up and die. There's different types of psoriasis, including plaque, which is the most common one that you think about, inverse in like the armpits and groin and skin folds. Guta is like the one that's from like the upper respiratory infections. Pustular could be caused by chemicals like smoking, and erythrodermic is the most dangerous and most rare that is very like widespread on the body. Different triggers include stress, smoking, alcohol, obesity, infections, cold, dry air, and then remember that those with family members that have it are more likely to get it as well. Patients with psoriasis need to be moisturizing their skin. Emollients are great for doing that. Corticosteroids and salicylic acid can help to decrease the inflammation to help treat the psoriasis. And then antifungals might be needed on those with that inverse psoriasis, where they might be growing some yeast in those armpits or groin area or under those skin folds. There's other optional treatments as well. The UV light therapy is great. Just remember, avoid sunburn. Methotrexate and biologic therapy, those both suppress the immune system. So typically biologics are the last resort because they're going to be more susceptible to other diseases, but they might need them. So if necessary, the doctor will order those. Thanks so much for listening, guys. I hope you've gotten a really good grasp on what psoriasis is and how to treat it. Now go out and be your best self today, and as always, happy nursing.